Those kids need a lot of help, and myself as a pediatrician, I dedicated myself to help all the kids. I work in the U.S. and I help all the kids who need help in the ICU in the United States of America. This is my first opportunity to prove to myself first and to the other kids that there's way more we can do for these kids who have no resources, no money, no infrastructure of good medical care. So coming here to help these kids, apart from my career, just doing this as a personal help to these poor kids, added so much to my perspective of medicine and the way I look at pediatrics overall. I lived in Syria almost all my life. I'm Syrian, that's where I was raised. And I went to the US 10 years ago to do my training and afterwards to practice my pediatric ICU career. And I always practiced my career there for 10 years. And I always wanted to do something for the Syrian kids in general and all the other kids in Middle East who we all know they need all kind of help we can provide. So having the US experience and all the resources and the advanced medical care that we can bring with us here with the whole team to help these kids that I always wanted to help in the past when I lived in Syria, but I couldn't because I wasn't able to help them at that time, adds so much to how I feel about the world. You know, it's those kids are left to nothing. They have nothing, no resources, no money. Their parents are, you know, barely able to survive, leave alone kids with congenital heart disease. So bringing all the resources, the expertise, the skills, the people to help these kids, and me being personally one of the Syrian doctors who is able to help a Syrian kid, it just take it to a different level. I come here to do something I always wanted to do, and which is helping these kids without waiting for any kind of payment or return. Indeed, my payment is seeing her getting better, seeing her smiling, the mom, and because we can fix those kids' heart surgically, but we're fixing a lot of other hearts emotionally, if that makes sense. I think they are very appreciative in a way that they become very attached to us. In a way, unintentionally, they take off all the barriers between us and they talk to us as family members. Like back in the US, which I like a lot, they talk to us, you know, as a doctor in a professional way. Here, they take all these barriers out and they become so attached to us and they looked at us like this mom or the other mom, look at me as their brother, that I'm here to help one of the family members. And that adds a lot of, you know, extra tie to the patient because, yeah, I get attached to my patient in general. I get more attached to them because we're the same language, same culture, and I know what they're suffering from, all these families, because I lived in that country, in Syria before, and I know the struggles. And I know when they see someone from their countries, from their culture, speak the same language, who's coming to help, they have expectation that you're not only coming to help, but you're our hope. For them, a lot of us look at us as a hope here, coming to help them and change their lifestyle by changing the outcome of their kids and children. I think the way I look at it, like back in the US, we take everything for granted, and we have a lot of resources, a lot of resources and infrastructure we utilize on a daily level. And sometimes we forget that there are other people in other parts of the world that need our help in a way that when we do something good there, which I feel like, or I like to think that we do every day, we get a little bit satisfied that we saved life. But we have to remember that there is a big mission. And being a pediatrician, it's a commitment to every single kid all over the world. And delivering good care and passionate care is a big mission for us, for any kid, wherever it's needed, whenever it's needed. So there should be no limits for what we should do for pediatric patients. In other words, this is not a favor I'm doing to these kids. This is a duty. This is something I have to do. Their right is to be helped by us. And the moment we commit ourselves and sign up to be pediatricians, it's a pediatrician with no borders and no limitations. So this is our responsibility. This is not a favor we're providing. And I will keep reminding myself of that, because no matter how much we are able to do, I think there's always more we should always be looking forward to do, and never limit what can we do to these kids. I think this is my first mission outside the US, and it definitely broadened my vision to what kind of medicine I practice and what kind of care I want to provide. And the more I do of those, the more thoughtful I will become about the care I should provide, and more importantly, what else I can do to reach out to the other kids who need us. There are some Syrian kids, some Iraqi kids, some Yemenis kids, but there are, I'm sure, some other kids from Asia, from Africa, from all over the world who need help. So yeah, I'm attached to these kids personally because they are the same culture, and I lived in this area a big portion of my life. But I don't want to be biased about that. I want to help the other kids that I'm not attached to, you know, on a cultural level or the religion level or a language level, but simply because they're kids. There's like a, you know, inside call coming to me saying, I need help, we need to be there. So I want to make sure I'm able to expand this work I'm doing, not only for these kids, but for all the kids who need help all over the world.
Bringing our training and experience back to Jordan, where I initially had my training as a medical student, is very important, coming as part of the mission. But the most important thing, I think, is for families who don't really understand the language. So English language, and on top of it is the medical language. Try to help them to understand the process, the disease, when the patient is critically ill is very important. You know, I think this is a big plus for us. You know, just giving back and also help the families trying to understand the process more. It's very hard. When you think about it, you know, you are taking your kid, giving your kid to the surgeons, to the team, and them trusting you to take care of the kid without understanding that much. And when they feel that somebody from their culture, from their language, is with their baby, they feel that it's more homey. There's somebody that they can relate to, talk to, make sure that we give them reassurance anytime. Coming back to my country of birth, you know, whereas, you know, I have still relatives here, friends and you know, kids of relatives and friends, you feel that, you know, this country give me, you know, the training, give me, you know, it made me a doctor, it gave me the basic training. And then when I went to the US, you know, I got the advanced training. But, you know, I will not be at the stage that I'm at without, you know, being trained here. So coming back and giving back to the country, to the people that trained me. I was at a conference at the beginning of the mission, and I saw my teachers here, you know, giving lectures to my teachers, and just, you know, tell them that they should be proud of me because, you know, they taught me, they trained me, and I'm giving back. So I'm not just treating the patients there, but I'm also treating the patients here in Jordan, and also trying to teach the medical students that they will be doctors and then specialists and consultants when they go back, when they practice more in the future. You treat patients, you spend time with them, but it's your regular time. You know, this is what you do. You don't feel that what you did is actually affected the whole family, saved the whole family, brought joy to the family again. And it's very meaningful for us because the time we are away from our family, like I'm away from my family for a week, it feels that it's totally worth it, more than worth it, that coming here, help other people, help bringing joy to other families. It's priceless. It's priceless.